Okay, the third thing that we're going to lose when we're massively hemorrhaging is heat. Okay, so when your temperature drops, that can induce what's called hypothermia. So we have a low body temperature. And we know from studying the homeostasis of body temperature that when your body temperature drops, two things are going to happen. You're going to shiver and you're going to shunt blood to the core in an effort to conserve heat. So when you shiver, your skeletal muscles are going to contract and relax and generate heat. Okay, in order to shunt blood to the core, we're going to vasoconstrict by targeting alpha-1 receptors. So you're going to go from this diameter blood vessel in the skin to you're going to constrict it. Okay, so by shunting blood to the core and away from the skin, you're reducing the ability to lose heat via conduction, convection, and radiation. Okay, now the problem is both of these processes require ATP because both of these processes require muscles to contract and relax at a higher rate than normal. Because you require additional ATP, that means that we need to do additional cellular respiration. The problem is you've massively hemorrhaged, so you don't have the ability to carry oxygen. So that means that we can't do the full-on cellular respiration and produce 36 ATP. We're going to be producing lactic acid and only 2 ATP. The result of shivering then is to drop the pH. Okay, so the treatment for this is to remove all the wet clothing and dry off the patient. Then you're going to cover them up again with warm blankets. You're going to jack up the temperature in the room, jack up the temperature in the ambulance. Okay, and if we do give IV fluids, we generally don't give a whole ton of IV fluids to trauma patients. We tend to give them blood or blood products. Regardless, you need to give them warm IV fluids or warm blood. Now, blood is stored cold, so we need to warm it up. Okay?